anatomical and physiological peculiarities of nervous system, psychomotor development, and semiotics of diseases of nervous system in children. Knowledge of the anatomical and physiological features of the nervous system in children is relevant to understanding the changes that can cause the development of pathology in childhood. The ability to properly investigate the state of the nervous systems of the child will allow the timely detection of symptoms and syndromes of its damage, which will facilitate the early detection of the disease, further establishing the correct diagnosis. The nervous system consists of the brain, the spinal cord, the peripheral nervous system, the autonomic nervous system, and sense organs. The main function of the nervous system is regulation of all physiological processes of the organism and regular adaptation of it to changing conditions of the internal and external environment. The nervous system of newborns and babies composes a number of specific morphological features, insofar as it is comparatively less mature and less differentiated than the other systems of the newborn. The child is born with big in size, by morphologically and functionally immature brain, the further development of which takes place under multiple influences of external and internal environments up to 16 to 21 years. Brain size and weight are relatively big at birth, 400 grams in average. That consists 1/8 of the body weight. In child of 5 years, 1/14, in adult, 1/40. Brain mass doubles to the age of 9 months, triples to 3 years. To 29 years, it becomes bigger in 4 to 5 times. Brain in newborns has gellous consistence, high contents of water, low contents of proteins and lipids, that can lead to brain edema, a different pathological condition. Poor differentiation between gray and white matter, convolutions and sulci of cerebrum are on development till 7 years. Nerve cells are also on development. Only 25% of brain cells are formed to birth. To 6 months, 66%. To a year, 90 to 95% comparing with adults. Nerve cells have big nucleus and absence of dendrites. Differentiation of nervous cells is reached at 3 years, and by the age of 8 years, brain cortex is similar by the structure with the brain cortex of an adult. High permeability of blood-brain barrier. Rich blood supply of the brain supplies the need for oxygen by the fast-paced growth of nervous tissue. This need for oxygen is 20 times larger than in muscles. Blood outflow from the brain in children during the first year of life is relatively slower comparing to adults. That creates conditions for toxic matters and metabolic accumulation in different diseases, which explains more frequent occurrence of toxic forms of infectious diseases in younger children. Myelination of nerve fibers is not finished, therefore speed of nerve impulse is low. Myelination of intracranial nerves comes to end by 3rd to 4th months, of pyramid waves by 2nd to 3rd years, of vagus nerve by 3rd to 4th years. The spinal cord is more developed before birth than the brain. Cervical and lumbar thickening are not determined in newborns and start to contour only after 3 years of life. Spinal cord weight is 2 to 6 grams. By 5 years it triples, and by 20 years increases by 5 to 8 times. The spinal cord in newborns is relatively long, ends at the level of second to third lumbar vertebra. In adults, between first and second lumbar vertebra. That is necessary to take into account at lumbar puncture. Two parts of the vegetative nervous system function from birth. Central regulation of respiration and cardiovascular organs is set by this time. Due to this, sympathicatonia is physiological for children of early age. This is changed by vagetonia at the 3 to 4th year of life, and then the balance of both systems is set. An important indicator of the functioning of the nervous system is the composition of the cerebrospinal fluid, which differs in newborns from adults. The total amount of cerebrospinal fluid in newborns is less than in adults and is 30 to 60 milliliters. In children of the first year of life is 40 to 60 and in adults up to 150 milliliters. The cerebrospinal fluid is renewed 6 to 8 times per day. The cerebrospinal fluid pressure is also lower and in newborns does not exceed 80 millimeters of water, while in adults it is 100 to 120 millimeters of water. Normally, children have colorless cerebrospinal fluid, but newborns may have xanthochromia. It is associated with the penetration of serum bilirubin through the blood-brain barrier in the case of physiological jaundice of newborns. The chemical composition of cerebrospinal fluid in newborns also differs from that in adults. The protein content in the cerebrospinal fluid of newborn is 0.33 to 0.49 gram per liter, while in adults it is 0.16 to 0.33 gram per liter. As a result, newborns may have a positive Pandy reaction, which is a qualitative reaction to protein. In addition, cerebrospinal fluid in newborns contains low blood sugar levels. Its concentration is 0.2 to 0.5 gram per liter, and in adults 0.4 to 0.6 gram per liter. In newborns, cerebrospinal fluid is clear. There are no neutrophils and erythrocytes, but there is a slight lymphocytosis. A newborn can have up to 10 to 15 lymphocytes in 1 milliliter of cerebrospinal fluid. The content of cells gradually decreased with age, and in children after 1 year, it is no more than 5 lymphocytes in 1 milliliters. Criteria of the psychomotor development assessment are the following: movements, statics, conditional reflexes, it is first signaling system, speech, it is second signaling system, and higher nervous activity. Movements are purposeful manipulative activity of the child. First of all, movement of eyes becomes coordinated on second to third week, when the child fixes the view on a bright subject. Turning of a head after a toy specifies development of cervical muscles on second to third months. Directed movements of hands appears on the 4th month of life. The child takes a toy on his hand. In 4 to 5 months, child begins turn from a back on abdomen, and in 5 to 6 months from abdomen on a back. In 7 months, child begins crawl, and by the end of the first year of life, movement of all muscles becomes coordinated and the child begins walk. Statics is fixing and holding of the certain parts of a trunk in a necessary position. Holding of a head in horizontal position appears in 2 months, in vertical position in 3 months. The child sits in 6 to 7 months and stands in 9 to 10 months. Reflex is the reaction of an organism to changes in the external or internal environment that is carried out through the nervous system as the answer to the receptor's irritation. Due to the reflex activity, the organism is able to adapt quickly to these changes. Conditional reflexes develop through the individual's development and skills accumulation. Conditional reflexes are formed on the background of unconditional with the participation of top parts of the brain. The main reflex of newborn is feeding. Unconditional reflexes are hereditary. Their arches are formed before birth and are normally preserved for the whole life or during a certain stage. Unconditional reflexes are divided into constant, transient, and adjusting. Constant reflexes exist during the whole life. They include swallowing, corneal, conjunctival, supraorbital, and tendon reflexes. Transient are observed in certain age and disappears as the brain cortex matures and its inhibitory influence on basal structure that enables in motor functional control. Transient reflexes are divided into reflexes of oral automatism and reflexes of spinal automatism. Basic reflexes of oral automatism. Sucking reflex is observed from birth till 10 to 12 months. Search reflex. At a stroking of a skin in range of an angle of mouth, don't touch to lip, the child turns his head aside. Reflex disappears at 3 to 4 months. Lip or trunk reflex. At tender percussion by lips, the child extends them forward like a trunk. Reflex disappears at 2 to 3 months. Babkin's reflex. At pressing by the big finger on a palm, the child opens his mouth and bends head toward chest. Reflex disappears at 2 to 3 months. Grasping reflex. Child holds the doctor's fingers enclosed in his palms. Sometimes thus the child can be lifted. Morris reflex. There are few methods of checking this reflex. In any cases, reaction of the child is identical. In the beginning, child violently moves apart his arms. It is first phase of Moreau reflex, and then covers himself by arms. It is second phase of Moreau reflex. First method. Doctor flaps by both hands on surface on which there is a child, on distance 15 to 20 centimeters from a head. Second method. Doctor holds the child on his hands, then lowers him down on 15 to 20 centimeters. There is a first phase, and lifts the child in initial position. There is the second phase. Third method. One unbends inferior extremities of the child rather quickly. Kernick's reflex. If one bends child's leg in knee and hip joints in line position, then it is impossible to unbend in the knee joint. Reflex disappear up to 4 months. Babinski reflex. Linear rotation of the foot lateral surface is carried out. Due to this, the toe is unbent. This reflex is supposed to be physiological up to 2 years. Reflex of support. The doctor holds the child in axillaries from a back and simultaneously holds the head of child. The child with his bending in knee and hip joints legs supports on the table. Automatic stepping reflex. If in the position of supporting reflex, doctor has inclined the child a little forward, he makes some steps. Defense reflex. If to put newborn on abdomen, he turns the head aside. All these reflexes disappear up to 2 months. Crawling reflex of Bauer. In a position on the abdomen, the baby tries to lift his head and makes crawling movements. If you put your hands under the baby's feet, he will actively push off his legs from your hands. This reflex disappears at 4 months. Gallant's reflex. If to put the child on lateral position and to draw with first and second fingers on paravertebral lines from a neck to buttocks, the child bends his trunk in direction of irritant. Reflex disappears at 3 to 4 months. Paris reflex. If the baby is put on his side and move your hand from the coccyx to the neck along the bony parts of the spine, this causes short apnea in the baby, then a sharp cry, lordosis, bending of extremities, hypertones of the muscle, sometimes defecation and urination. This reflex is checked up at the end of examination as it causes pain in a baby. This reflex disappears at 3 to 4 months after birth. Basic adjustive reflexes appear in certain age. For example, Landau upper reflex appears in 4 months. Being on abdomen, the child lifts the head and the upper part of trunk. Landau lower reflex appears in 5 to 6 months. Being on abdomen, the child bends and lifts his legs. Speech is an important feature of psychomotor development, intelligence level and person's literacy assessment. It includes 2 main components, sound reproduction and their understanding. Therefore, speech is an ability to reproduce understandable sounds. Speech is the result of complicated coordinated work of the central nervous system, respiration, and phonation organs. Speech appears in the child on 4th to 6th week, when bass, first sounds appears. In 6 months the child begins separate syllables and babble appears. And by the end of the first year of life, there are 8 to 12 words in a lexicon of the child already. High nervous activity is the sign of maturity of mental ability and intellect of the child. High nervous activity usually carried out during observation of child's behavior and his/her reaction to the environment. Attention is paid to how the child plays with toys, draw, turn over the pages, and other. The notion can be made about his/her ability to focus attention on certain object or process, to make the conclusion about motor coordination, ability to solve current tasks. Conversation with the child of corresponding age allows to assess speech, the ability to education, to determine the delay of intellectual development. The final conclusion about a state of the higher nervous activity can be made at 5 to 6 years. Neuropsychical development of the child is one of the indicators of his health. The level of neuropsychical development reflects the state of the child's central nervous system. The ability to assess the neuropsychical development of a child is a necessary part of the work of pediatrician. Timely detection of abnormalities in the development and behavior of the child is important because it allows the early stages of the necessary correction. And now details the psychomotor development of children of first year of life. In 1 month, child holds a head in horizontal position, looks after moving object, first smile appears, and begins to buzz. The child begins to pronounce sounds that remotely resembles vowel sounds. For example, A, E, I. In 2 months, child holds a head in vertical position, turns the head to the source of sound after a toy, quickly answers by a smile at conversation, buzzes well, fixes the look on a bright toy. In 3 months, in a position on an abdomen, child supports on forearm, supported armpit stands on half-bent legs, turns on a side. Musical sounds cause positive emotions, buzzes to mother, hits by hand the toys accidentally. In 4 months, child sits at a support for a pelvis, begins to turn from back on abdomen, laughs loudly, knows her mother. Laryngeal sound appears in his bath, pulls a hand to a toy. In 5 months, in the position on an abdomen, child supports on palms, supported by armpit stands on straight legs, turns from the back to the abdomen, distinguishes relatives and strangers, intonations of speech, knows voice of the mother. Melodic buzz appears. Child takes a toy from the hands of an adult and a long time keeps it. In 6 months, child can sit, turns from the abdomen to the back. Different reactions on his and other name appear. Child interests in his reflection in a mirror. Beginning of babble. It is pronunciation or singing of syllables such as ta-ta, ba-ba, ma-ma. The child begins to understand the speech of adult, reacts on intonations, recognizes familiar voice, shifts a toy from one hand to another, eats from a spoon, drinks from a cup which an adult holds. In 7 months, child crawls in various directions, glides to the nice person, babbles for a long time, gives the toys, and finds the object in eyeshot. In 8 months, child stands near support, sits down, lies down, stands up, makes some step near support, smiles and glides to his reflection in a mirror, plays hide and seek, repeats after adult syllables which already is present in his babble, makes pat a cake, goodbye, gives a hand. In 9 months, child can walk with support, knows his name, turns on a call, tries to build a pyramid. In 10 to 11 months, child stands unsupported, walks for a hand, glides to see other children, builds a pyramid, opens and closes the boxes. In 12 months, child walks independently, understands prohibition, gives a toy to other children, knows relatives on a photo, has 8 to 10 words in a lexicon, takes a cup from a table, drinks from it, puts it back, carry out the simple orders. Assessment of psychomotor development is carried out at a certain age, epicrisis term. The norm of development considers mastering by skills within the limits of one epicrisis term. For the children of the first year of life, the epicrisis term is 1 month, of the second year, 3 months, of the third year, 6 months, and then 1 year. According to the level of psychological development, there are 4 groups of children. First group: children with development in borders of norm or with an advancing of development. Second group: children with a delay of development on 1 epicrisis term. Third group: children with a delay of development on 2 epicrisis terms. And fourth group: children with a delay of development on 3 epicrisis terms. For the estimation of psychological development of the child, it is necessary to compare his skills and control parameters of skills. There are 3 degrees of psychological development delay. The first degree, delay of the development on 1 to 2 parameters, the second degree on 3 to 4 parameters, and the third degree on 5 to 7 parameters. Semiotics of violation of psychological development in children. In some cases, factors of environment can cause breaking of maturing of structure of a brain and their functions. It leads to a delay of psychological development. The delay of mental development can be compensated in future or not. Down syndrome, also known as trisomy 21, is a genetic disorder caused by the presence of all or part of third copy of chromosome 21. The basic manifestations of Down syndrome are delay of psychological development. Parameters of statics develop on second to third years of life. Sometimes children may start to walk till 5 years and later. Speech appears later. In 3 to 5 years, child can say separate words. Pathognomic external signs. Slanting cut of eyes. Its so-called Mongolic eyes. Wide flat bridge of nose. The big sizes of tongue is frequently put out from a mouth. Short neck. Short feet and hands. On a palm transversal furrow, its so-called monkey's furrow, is frequently present. Affection of internal systems is characterized for Down syndrome. Undevelopment of a brain, infringement of differentiation of nerve cells, and myelinization of nerve fibers. Reduction of the size of internal organs and their defects. In 25% of cases, there is congenital heart disease, such as Fallot disease. The muscular hypertension is expressed already in the early neonatal period, and it often kept for all his life. Semiotics of the basic diseases of nervous system in children. Two main complaints that are typical for diseases of the nervous system refer: headache, dizziness, nausea and vomiting, impairment of consciousness, infringement of mentality, impairment of memory, change of speech and speech development, convulsions, paralysis, and uncoordinated movements. Assessing complaints that are provided by parents or child, it is necessary to determine their character, duration, intensity, and also factors that increase or decrease the expressiveness of this symptom. It is necessary to remember that some symptoms can occur in nervous system pathology as well as in affection of other symptoms. So, symptoms should be assessed in the context of clinical situation and in complex with other signs. For example, vomiting that accompanied by abdominal pain and diarrhea is more likely conditioned by the pathology of the gastrointestinal tract. At the same time, the presence of intensive headache, dizziness, and coordination impairment with high probability indicates the central genesis of vomiting. Besides the assessment of complaints themselves, doctors should determine the moment of pathology first signs occurrence. Determine if they have constant character or occur periodically, and also assess the dynamics of symptoms development. Meningeal symptoms are conditioned by irritation of nervous receptors of dual matter. Symptoms are checked in the lying position on a back. Rigid neck. In patient that is lying in horizontal position, Doctor cannot bend the head forward. Top-Brudzinski symptom. Similar actions lead to bending of the lower extremities in knee and hip joints. Medium Brudzinski symptom. Bending of legs in knee and hip joints at pressing on pubic area. Low Brudzinski symptom. At lifting one leg, another has bent. And Kernig symptom. Impossibility of unbending the leg in a knee joint if it is bent in a hip joint. Symptoms of latent spasmophilia, infantile tetany. Costic symptom, spasm of mimic muscles of the face at percussion in points of output of trigeminal nerve. Trousseau symptom, spasm of muscles of hand of obstetrician, at squeezing of neurovascular column in the field of upper arm. Loose symptom, spasm of muscles of foot, dorsal flexion, at squeezing of chin. Hydrocephalus is a disease which characterized by increase of pressure of liquor and dilatation of encephalon. In most of the cases, hydrocephalus occurs due to the obstruction that impairs normal liquor circulation. Congenital and acquired hydrocephalus are defined. Process of cerebrospinal fluid formation and circulation is rather complicated and mainly depends on the degree of its production and resorption. Vascular plexuses of the brain ventricle system are the main sources of the cerebrospinal fluid production. 15 to 30% of the fluid is formed outside the ventricles by the diffusion through the vascular walls of pia mater and ependymal vessels. Cerebrospinal fluid from lateral ventricles constantly outflows to the third ventricle, and then through the Sylvian aqueduct to the fourth ventricle, from which through medium and lateral foramens it gets to the last cistern, wash surface of brain hemispheres, and then gets to the subarachnoid space of the spinal cord. Then it again gets to the brain subarachnoid space, where it is resorbed to the venous and partially to the lymphatic system. Therefore, by localization, hydrocephalus can be external, internal, and general. Hydrocephalus symptoms depend on child's age, disease's duration, and speed of its progression. At congenital hydrocephalus, in newborn the sizes of a skull are normal or slightly increased. Then from the first weeks of life, the head gets the form of sphere, cranial seams open, the sizes and the tangent of big fontanelle increases. Fontanelle is long time open, and also the sizes of small fontanelle increases. Thinning of skin of a head and expansion of venous network of a head. Pathognomic symptom for a hydrocephalus is sunset sign. The part of white sclera between cornea and upper eyelid is visible. Gradually, the child gets delay in physical and psychological development. The child cannot hold his head, sit, walk, eat on his own. The child loses his weight and does not grow. The forecast for life is more often negative. Cerebral palsy. This is a group of non-progressive neurological frustration owing to infringement of formation of brain during the early period of its development. The cause of any cerebral palsy, pathology in the cortex, basal areas, capsulas, or brain stem. Most frequently, the cerebral palsy arises at action of exogenous and endogenous factors during antenatal period. Quite often, infringements cause a birth trauma and asphyxia of fetus. Serious or long infectious diseases, craniocerebral trauma, can cause cerebral palsy in postnatal period. Clinical manifestations of cerebral palsy: uncoordinated movements, expressed muscular hypertension, infringement of speech, mentality, visual, hearing, and sensitivity impairment, convulsive syndrome, spastic diplegia or little disease, paralysis of both upper and both lower extremities. It is tetraplegia. Meningitis. It is an inflammation of brain tunics. Meningitis occurs as independent disease or as a complication of other process. By an inflammation character, meningitis can be serous or purulent. Serous meningitis is caused mainly by viruses such as Coxsackie, E. coli. Main causative agents of purulent meningitis are meningococcus, Haemophilus influenza, and others. Mechanism of infection with bacterial meningitis is usually droplet. For viral meningitis, fecal-oral route and transplacental. Symptoms of all acute meningitis forms are very similar, independently of etiology. Meningitis is diagnosed on the basis of three syndrome complex: general infectious, meningeal, and inflammative changes of spinal fluid. General infectious syndrome usually includes fever, headache, and intoxication syndrome. Headache is usually intensive. Monotonous crying is usually observed in infants. Vomiting and nausea are observed on early stages of the disease that are not connected with food intake. Occurs on the background of headache's intensity increase. In small children, bulging, tension of big fontanelle and its pulsation is possible. General hyperesthesia, increased sensitivity, touching to skin is painful. Meningeal position or a pose of hound dog is characterized for meningitis. The child lays on one side, the head is thrown back, and legs are pressed to abdomen. Meningeal symptoms are positive: Kernicks, Brodzinski, and rigid neck. Diagnostics of disease is difficult. Most objective method of diagnostics is lumbar puncture. At purulent meningitis, liquor is muddy, greenish, pressure is raised, high viscosity, the contents of protein, leukocytes, many neutrophils, is sharply increased. At serous meningitis, liquor is transparent, colorless, pressure is raised, the contents of protein, leukocytes, mainly lymphocytes, is moderately increased. Convulsions. It is involuntary muscle contractions that manifest like attacks, which last for different time and are clinical signs of central nervous symptoms. Different diseases can be causes of convulsions: hydrocephaly, encephalitis, meningitis, craniocerebral trauma and epilepsy, intoxications, infectious diseases such as flu and pneumonia, dehydration, impairment of water electrolyte balance, hypoglycemia, spasmophilia, and hypocalcemia. Convulsions can be tonic, clonic, and tonico-clonic. Clonic convulsions is fast muscular contractions that follow one after another in a short period of time. They indicate the excitation of the brain cortex. Clonic convulsions start from facial muscles fasciculation that quickly pass to the limbs and become generalized. Tonic convulsions is continuous muscular contraction that occurs slowly and lasts for a long period of time. The occurrence of tonic convulsions indicates the excitation of basal brain structures. Convulsions can be local and generalized. Tonic convulsions can occur after clonic convulsions, for example, in epilepsy. Emergency help in convulsive syndrome. For prevention of a mechanical trauma, to put the child on a soft surface or to put under a head something soft. To release a trunk from tight clothes. To clean respiratory ways of slime. To turn the head of the patient on a side. To fix the lower jaw, move out it forward. To place spatula or spoon between molars to prevent tone trauma. Thank you for your attention.